introduce us first so I can get the panel started.
Srilekha, and thank you, Srilekha, for putting this all together along with Padma. And I really appreciate we had a grand plan for the convention, but unfortunately, because of this, we can't do the physical. So we are trying to do this virtually. And Srilekha, I met her in Washington, D.C. She's very activist in the social area in the Washington, D.C. area. Thank you, Srilekha, for helping us putting together. Thank you so much. It's up to you. Please take it over.
Thank you, Dr. Reddy. And thank you to American Association of Physicians of Indian Origin and to obviously President Dr. Reddy for providing me an opportunity to facilitate the panel on healthcare policy by state legislators, Senator Dhingra, House of Representatives Dr. Kumar, and Mrs. Cooper. So this is how I would like to kind of get started. I will give a little introduction about each one of our honorable guests, and I will have our honorable guests speak for a few minutes before we start taking questions from the audience. While we are going through this panel, audience, please feel free to type in any questions. I will kind of assemble the questions and try to synthesize the questions and put it back to the panelists. Our panelists on Father's Day have taken the time, and also the audience, happy Father's Day to all of you. This is a very good day for us to have a great panelist crew talking about our policy in healthcare. So healthcare policy, as we all know, it refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. And the healthcare system in our country, in the United States, has experienced unprecedented changes and growth since World War II, but especially during the past 20 years. These changes not only reflect a multitude of developments, including fundamental shifts in the political and philosophical underpinnings of American life, dramatic advances in the technology of medicine, evolving expectations on the part of the consumer towards physicians like all of you in the audience, and different characteristics of the population like you and me, and the healthcare problems we all experience. It is my pleasure to have an engineer, Ms. Cooper, a surgeon, Dr. Kumar, and an attorney, who is our Senator Dhingra, as our state legislators and the panelists. A little bit about Senator Dhingra. Senator Dhingra is our Indian American attorney and a politician who is a Washington state senator. She was elected in 2017 to serve in the state Senate by constituents of the 45th Legislative District on Seattle side, east side in King County. Her priorities are to address the deficits in education funding, mental health and violence prevention, and to protect the rights of women. Prior to being elected, Mrs. Dhingra was a co-founder of CHAYA. It's an organization that assists South Asian survivors of domestic violence and led the organization's work to end systemic violence through education and prevention. She also serves on the board of the National Alliance on Mental Health Illness East Side. That being said, Senator Dhingra, I will let you speak a bit about yourself and about health policies that you have been involved in.
Thank you so much. Thank you for that introduction, and thank you for putting this together. As she mentioned, my name is Manka Dhingra, and I represent the 45th Legislative District, which is parts of the city of Woodinville. That's where you get all our wonderful Washington wines from. The city of Redmond, as you may know, is the home of Microsoft. Parts of the city of Kirkland, and if you shop at Costco, you know that's where Kirkland's signature brand comes from, and the cities of Duval and Sammamish. I am fairly new to politics. I ran for office for the first time 3 years ago after our national election. I've been a senior deputy prosecuting attorney with King County for about 20 years, and I created and ran a behavioral health alternative unit. So I ran our mental health court, our veterans court, our diversion courts, and I also helped develop and train law enforcement in crisis intervention responses. So I decided after our last national election that I had to get more involved. And so I ran for the Senate for the very first time. And I'm very fortunate that as a senator, I chair the Behavioral Health Subcommittee. So in the last few years, we've done a lot of work around integration between mental health and physical health. We have done a lot in rewriting our civil commitment laws, taking a look at the forensic mental health population, doing a lot to help individuals get access to substance use disorder treatment. I also am vice chair of the Law and Justice Committee, and given my background as a prosecutor for 20 years, I take the criminal stuff and my chair takes the civil stuff. So it's a really good mix that we have going in the criminal justice realm. And as we know, behavioral health issues and the criminal justice system interact quite a bit. I also sit on a health and long-term committee. We will talk a lot more about the policies that I've worked on there. And I'm also on the Ways and Means Committee, and that is the committee that deals with the money and helps develop the budget. I was also honored about 1.5 years ago to be elected as Deputy Majority Leader. And it really has been a privilege to be part of the leadership team in Washington State. And I'll just like to say that, you know, representation matters. It makes a big difference when people from different backgrounds have a seat at the table. And to everyone listening out here, I just, you know, you guys are mostly all doctors, and that's great. Indians are very well represented in the medical field, in the engineering field. And it is just as crucial to make sure we have representation at all levels of government, at all levels of businesses, and all levels of society. So thank you for creating the space for lawmakers to talk about the policies that we've been working on. The last 3 years in the state of Washington, we have actually tried to make sure that we are trying to protect the benefits that we have received under the ACA and codify them into state statute, so that regardless of what's been happening at the federal level, we are protecting Washingtonians. So that has been a lot of that focus, and I'm sure we'll get into details as the panel goes forward. So that's been the other venue for policymaking that we have really stressed. And really taking a look at things like surprise billings, taking a look at maternal mortality. As we know, the numbers are fairly shocking in the United States when it comes to comparing it to other developed countries on what a maternal mortality rate is. We've been doing a lot of work around equity on making sure that people from all aspects of life have access to healthcare, and really making sure that regardless of your skin color, you have the same access to resources, because we know in this country that that is a huge factor. So also taking a look at poverty and ensuring that people on all levels of the spectrum have that access. So that, in a nutshell, is the overall picture of what we have been working on in the healthcare realm, and I'm happy to answer specific questions.
Senator Dhingra, that was great introduction and all the great things that you're doing. I'm a healthcare professional myself, and I think during COVID situation, we've seen that the health disparities become so much more apparent than it was before. So hopefully with all of your representation from minority, Asian, South Asian communities, we can not only work on those disparities, but advance in the world of technology and medicine. Thank you so much for the great introduction. Now I will move on to Dr. Saba Kumar. Dr. Saba Kumar is a Republican member of the Tennessee House of Representatives and is a surgeon. He has represented the 66th district since 2014, which encompasses Robertson County. Dr. Kumar is a board-certified general and vascular surgeon and the president of Nashville Surgical Instruments and a fellow at American College of Surgeons. I work with surgeons on a daily basis, so I have humongous respect for surgeons, especially vascular surgeons for sure. And Dr. Kumar is also a member of Finance, Ways and Means Committee. He's a member of Health Committee, and also he chairs the Mental Health and Substance Abuse Subcommittee. Dr. Kumar, we are very much looking forward to learning about your expertise. Please take it away, sir.
Thank you. Can you hear me?
Yes, sir.
It's certainly an honor to be here and to be invited. My experience has been exceptionally good. I have really enjoyed the legislative part. As you mentioned, I'm a surgeon. So I came to Springfield, Tennessee, which is just outside of Nashville. And I have practiced here for the last 43 years. I really did not have any political aspirations. I took interest in politics as such, about policy, what goes on with our society, and always involved in our community matters as a participant, donor, serving on various boards. And when I arrived here after a few years, as I realized that it was a very good community, very receptive to me, and my practice was quite busy. I married here locally, and my wife Linda has been very much a part of a team that we work together. She's also involved in the community and serving on various capacities, whether it is the YMCA or the CASA board. Not having had any political aspirations, we noticed that there was an open seat for a person for the state house. And my daughter, who is an attorney, she practices in Nashville now, she was asked to run. And we called her at that time a baby attorney. She was just getting started with her practice, and she really did not have the time. And I made a remark that it will be exciting to be involved in a situation where decisions are made about health, education, criminal and civil justice, agriculture, insurance, banking, and such a wide array of things that affect our society. It'll be exciting. And next thing you know, I was encouraged to run. And for me, having been in the community at that time for 37 years, of course, there were friends of ours who were also running, who were third generation local people. And I said that by marriage and by 37 years in the community, I claimed native status. And my election was easy, mainly, I thought, to a great extent from name recognition and having served the community. At the legislature, the reception has been good. I think we as professionals are received very well from day one. You instantly command respect as a professional. And people have been really, really good and receptive. And I served my first 2 terms on the education and health committees. And now, as you mentioned, I'm on, of course, health and mental health and substance abuse, as well as finance, ways and means. And it has been very, very interesting. I've really enjoyed serving the community. On a local level, getting roads built is what really matters. At the state level, of course, I would like to see certain things done to improve our education, try to end the curse of social promotion. And by way of health, we are at the opposite spectrum of Senator Dhingra's state. We are a very conservative state. We are 80% Trump voters. And our emphasis was not towards Affordable Care Act. Our governor did try to expand Medicaid and accept the promises and money offered in the Affordable Care Act. And I was inclined, I was definitely going to support it on a healthcare. But the legislative bill was not such. So we have never expanded Medicaid. And yet the overall, the social net, safety net has been sufficient. But I do agree that there is work to do in making affordable healthcare available to all Tennesseans. And we continue to work towards that. I have lost track of time. I think that may be sufficient introduction. I do serve on the clinical faculty at Vanderbilt University, and I do own a surgical instrument company, as you mentioned, National Surgical Instruments. And it has been a blessing and a great experience to be here. Thank you.
Dr. Kumar, that was a wonderful introduction. It's always good to hear from a state legislator that says that you're in the field to serve the community. And also, I think this is a very well-balanced panel. I'm a conservative myself. And then we have 2 Democrat candidates. And in order for democracy to survive, you always need to have well-balanced ideas. And this is a great forum. I hope physicians on the other side are kind of enjoying both sides of the panel at this point. So now I would like to move on to Mrs. Cooper. She's actually my personal friend and I admire her the most. State Representative Padma Copay is serving her first term representing Michigan's 41st House District, which encompasses the cities of Troy and Clawson. Mrs. Cooper moved to the 41st District more than 20 years ago. Since then, she's worked as an engineer and project manager with a career that spans the automotive, financial, and IT industries. Throughout her life, Mrs. Cooper has sought to bring people together to solve problems both in the professional world and in the community. I would like to highlight that Mrs. Copay is on Prescription Drug Task Force and Michigan STEM Council. She has been a civic leader, and I've known about her civic leadership for a very long time. She's volunteered with PTA, founded the Troy Area Interfaith Group, trying to bring people of all faiths together, which is so very, very much needed at this point in our generation. And she's also serving on Troy's Planning Commission. I would like Ms. Copay to talk about our objectives for the panel. Take it away, Ms. Copay.
Sure. Thank you so much to Dr. Reddy, to all of you who are here, all of you who are watching, and to Manka and Sabi, who I called last Sunday and said, hey, want to be on a panel with me? So I'm in Michigan, which we have our entire executive branch is women Democrats. Our governor, our attorney general, and our secretary of state. On the legislative side, in the state house, both chambers are under Republican control, Republican-led majorities. I myself am the first Democrat to serve this district. And I will tell you, to me, I never really wanted to run. I came to Michigan 20 plus years ago to work in the auto industry. I saw the big Chrysler Pentastar at the tech center, and I was excited. I had 2 young children. My husband and I are both engineers, and we made Troy our home because not only were there job opportunities, most of us are economic immigrants, right, for economic reasons, and also the great schools, the great community services that the city of Troy provided, in addition to the fact that there was a significant Indian American population. There's a large temple, there's a mosque nearby, there's significant South Asian communities. So the grocery shopping and the restaurants were great. I never really thought of running, and people kept on suggesting that I run because I was an activist. I really was upset about public education funding. And so that was really the basis that finally I threw my hat in the ring to run for office in 2018. As I watched what Michigan has done to public education, we were seeing it unfold on the national stage. And so when I took on this position, I really was focused on a few things. I thought the ACA was something, and healthcare was something that you did at the national level, and I didn't understand, honestly, how important a state legislature could be in protecting healthcare policy and affecting public health. I always knew that as a state, used to be on planning commission, I knew that people were concerned about the environment and clear cutting of trees, and also besides public education, the environment and protecting the Great Lakes and our water supply were also important. But I got into the legislature and I was appointed to the Energy Committee. I was appointed to local government and municipal finance committees, basically to align with my interests and my experience. But I started seeing how many ways we could get connected. So a lot of different groups. That first 4 months, it was like drinking from a water hose, probably a lot like med school, I don't know. Just trying to learn about all the different stakeholders that want to have your attention as a legislator and who want to convey to you their interest both in enacting legislation and also opposing any legislation that comes before you. One of the things I also discovered was that about 80% or even 90% of the legislation that we pass is bipartisan in nature. There's no, they bring all the stakeholders together and they discuss, and everybody's not satisfied. Really, truly, if you think about it, neither extreme is the winner, right? A good policy requires that everybody give a little. And so I think coming from a district that I call a purple district, coming from divided government, which is, you know, Republican legislature and a Democratic governor, I think that places me really, really ideally to work across the aisle. In fact, my first bill was to protect the vulnerable. And so to protect someone from with Down syndrome or autism, somebody who's an adult, from online sexual predators, because we have laws on the books. Now, that was in 2019. My second year in office, 2020, the first bill I introduced was part of a package to enact the ACA here in the state of Michigan, as Senator Dhingra was talking about. Now, we don't have a friendly legislative chamber for those bills to even get a hearing. And so right now those are stuck, but I can speak to, I'll stop for now. And as questions come up, I will be happy to talk about why the ACA is so important to the state of Michigan.
Mrs. Cooper, that kind of leads me to my next questions about ACA. I think you kind of put in a very good foundation to our next part of discussion. I enjoy the fact that you talked about how activism and frustrations are not something that can only be unfolded by taking constructive suggestions and kind of moving forward on doing something in a public platform versus sitting around kitchen table and venting about it. And that's exactly what you did. You took the local politics and you're trying to take them into national politics. And we're very, very proud of you for doing that. So this is a good time for the physicians that are in the audience to kind of start putting in questions. You heard the great introductions of all the legislators that are present right now. So the best time for you to start putting your questions in the chat. So state legislators, as you know, make thousands of healthcare policies decisions each year, including improving access to appropriate care, determining who should be immunized, licensing healthcare professionals such as me and the physicians that are out there, and facilities, healthcare facilities and hospitals, are also supporting or rejecting initiatives to keep people healthy. So these are like a lot of competing ideas that comes from knowledgeable senators. But in the midst of all these competing ideas, what is the best way to reshape our current healthcare systems? And also I'm curious to know, as legislators continue to debate at the state and national level, if ACA is going to be overturned, what measures are you putting in place in your state? I'll start with Senator Dhingra. Basically, the question is, if ACA is going to be overturned, what measures will you be putting in place in your state?
Thank you for that question. And, you know, we mentioned divided government in some of the other introductions. So I just want to take a moment and talk about how important who represents you really is. So in the state of Washington, I know everyone thinks of us as this amazingly liberal state. We actually did have divided government before my election. We had a Senate that was controlled by the Republicans, and then we had a House that was controlled by the Democrats, and a governor is, of course, a Democrat. With my election, I actually flipped control of the Senate. So we are now a trifecta. So we have Democratic control in the Senate, the House, and the governors. And I will say that even that one extra vote has been really crucial in the legislation that we have. So after my election in 2018, we actually made sure we had a bill regarding reproductive parity, making sure that health plans cover all types of contraception, that if they're going to cover maternal health, they have to make sure they're covering the entire spectrum of reproductive care, including abortions. The next year after that, we really made sure that we were putting the protections of the ACA in our state statute. So we passed legislation that protects coverage so that people don't have to worry about losing coverage for pre-existing conditions. We're making sure people don't have to fear losing coverage because of lifetime spending caps. And as it turns out, we actually made sure that we prohibit discrimination on the basis of gender identity. And we know last week how crucial that was for states to have done that, because that protection was removed at the federal level. And we also made sure that all of these protections also went into effect for short-term and student health plans, so not just the big plans that we talked about. Last year, we also strengthened our consumer protection laws by protecting patients from surprise billing. I know that's something we have had a lot of conversations at all levels of government, the federal, states, but we were able to do that to protect them from from surprise billing from out-of-network providers. We also had to revamp some of our options that we have in our current insurance market because of what's been happening at the federal level with the increases in premiums and deductibles. So we created a public option. It's called Cascade Care. It's the first in the nation. And it's done so that we can decrease cost of payment, premiums, copays, and other out-of-pocket expenses on the individual insurance market. So Cascade Care is available to all Washingtonians, regardless of income, for those who are not covered by an employer. And this is in addition to a Medicaid program, which is called Apple Care. As you know, Washingtonian provides a lot of the apples that we eat nationally, hence Apple Care. We also funded a study that involves all relevant stakeholders to lay out a plan on how we in Washington could implement a universal healthcare system. So we have Cascade Care, we have Apple Care, and then a plan to study how we can do universal healthcare for our state. We are aware that we're not going to get any federal waivers in order to do a universal healthcare system right now, given our administration. And so we want to make sure we are ready that if there's a change in administration, we can ask for a federal waiver in order to get universal healthcare in the state of Washington. We also had to go back, since we passed the Reproductive Parity Act in 2018, to actually provide some teeth to that law, because we were seeing that it wasn't implemented in the way that we wanted it to. So our Office of Insurance Commission is now allowed to assess a fee on healthcare or health plans that exclude mandated benefits, such as reproductive care. And so this fee is the equivalent of the cost of providing the excluded service. And the healthcare carrier must notify each enrollee of the excluded benefits and explain an alternative way to access these services. And, you know, as was mentioned earlier, a lot of these policies come together because people are working on it. Even this, the assessing the fee is something that the insurance companies were on board with, given the way that it was framed. I mentioned maternal mortality in my introduction, and I do want to stress that, you know, in the US, more women die from pregnancies, from complications, from pregnancy-related complications than any other developed country, and that rate is rising. And so we really wanted to make sure that we are doing what we can to understand the issue and address the issue. So we extended our maternal mortality review panel to really make sure we are doing an in-depth study of the issue, requiring autopsies that we can then understand exactly what was going on. And I'm looking forward to results of that study to see what steps we need to take. But, you know, making sure that people have access to healthcare at all aspects is really the crucial step in making sure people are not dying for healthcare related issues, and also making sure that people don't have to go into bankruptcy simply because they get diagnosed with cancer. And we see that a lot from low income and even middle income households, that, you know, they get ill and they are worried about whether they need to sell their house or how they're going to pay for their kids' college. And you know, we really cannot drive people into poverty because they're unable to access healthcare.
So, Senator Dhingra, that was very well said. You literally, I think, ended off on a very touching point. We can't drive people into poverty. Healthcare has to be a basic human right. Thank you. I have actually in a chat box, I have a very good question from Dr. Rappareddy. So Dr. Kumar, Dr. Rappareddy referenced this question to you. So if you can answer this. Dr. Kumar, the AMA and TMA has been advocating for mental health and substance abuse parity. Can you comment? Some states have passed it, but not Tennessee. Can you please comment on that?
Certainly. Thank you for the question. I think it has to, we have to understand philosophically where Tennessee is. We are a conservative state. Both houses of the legislature are 75 to 80% Republican. The governor is Republican. The state itself and the people value individual responsibility. There is overall, the effort is to maintain entitlements only as a safety net, an effective safety net, but only as a safety net. The history is that in around 2007 or 8, under Democratic governor, Medicaid was expanded, and with time it grew to be such a large percent of the budget, up to 40%, that the program had to be cut back very significantly, and causing a lot of pain and hardship for a lot of people that depended on state Medicaid program for for their health care. So since that experience, the feeling in the legislature and among the governors has been, we don't want to go back there. And certainly people do get care. The laws are there so that care is provided through this and other special programs for cancers and for women's health and so forth. But generally, it is not the emphasis in our state to provide more programs and entitlements. For that reason, it has been considered, and I think it's an important matter. Actually, this year, our governor, in our pre-COVID budget, did put in a significant amount of $250 million towards mental health and substance abuse care. So efforts were made, although it was not titled as parity, but that's a significant amount for our state budget of about the state population of about 7 million people. And we were very delighted with that. And as you know, I chair the Mental Health and Substance Abuse Committee. We were very happy with that. However, because of the COVID downturn, and as we get figures of our sales tax collections and revenue coming in over the last 2 months, we've had to put that program on hold. We hope to be able to revive it, but certainly there was a genuine effort on the part of the governor and the legislature to contribute towards more towards mental health and substance abuse problems. We have legislatively worked hard to control the spread of substance abuse and the opioid crisis. I'm, of course, being one of the 2 physicians in the House, I'm very much involved in it. And I think we have been successful in cutting the opioid prescriptions and usage down. The sad part of it being the problem that is a universal problem in the United States. So opioid prescriptions dry up and less are prescribed, but at the same time, sadly, the heroin use goes up. So overall impact on mental health is not what we had hoped for it to be. I would wait for you to ask me when it's time for me to give my input on Affordable Care Act.
Yes, sir, Dr. Kumar, we'll surely get to Affordable Care Act again. But I think that thoroughly, you explained that balance very thoroughly. Thank you for doing that. This question is for Mrs. Cooper, coming from Dr. Trivedi. So Dr. Trivedi says, I definitely support the accessibility. Let me go to the question, I'm sorry. This message again is for Dr. Cooper or Ms. Cooper. So coming from Dr. Trivedi. I know, right? Question is, can we protect the most vulnerable to COVID by providing free of cost those prescription medicines for diabetes and cardiovascular disease that are both in the medical guidelines and proven cost effective? Why should these meds not be made available freely when cardiovascular disease is the #1 killer, plus is a huge risk factor for COVID?
So this is a really good question because I am on the prescription drug task force and we haven't really been able to meet because of the coronavirus and the stay-home orders. We're still in the process of safely reopening. So I definitely support the accessibility and affordability of prescription drugs for everyone, but it requires working with everyone in the legislature and other stakeholders to make that happen. And that's what I put in the chat window. And I just want to give you an example of something that we've introduced. One of my colleagues introduced making insurance companies cap the copay for insulin at $100. I was going to put for a 30-day supply. I actually have a bill that I haven't dropped to cap it at 50 because I have a large number of constituents who used to drive over the border to Canada to buy their insulin because it's just not affordable here in Michigan. And so I'm stuck because the agenda is set by the majority and I'm unable to find someone on the other side who's willing to champion this issue and get it a hearing. I don't know if you remember in the beginning in my opening remarks, I talked about the bill that I have for protecting vulnerable adults. It took me more than 5 months to get that bill a hearing. Then it got referred to another committee where it has been sitting for a year literally since June of last year. It's been sitting in the Judiciary Committee. It doesn't cost anyone anything. It would require maybe a 20-minute or an hour-long hearing, and it could easily support getting through to the chamber so we could vote on it there. But when you don't hold the gavel, you really, I mean, retail politics is really eye-opening for me, because I thought, you know, rose-colored glasses, I did pluralism, I didn't do them versus us. And I'm really learning how quickly in the legislature, the agenda is set by whoever holds the gavel. So I would love to get the gavel and work with the stakeholders and require that prescription drugs are more accessible and affordable for everyone.
Thank you, Mrs. Cooper. You're absolutely right. That's how the community goes. Whoever has the gavel makes the agenda, and thanks for your bipartisan efforts. I know personally you tend to reach out quite a bit you reach across the aisle to ensure your bills are passed. So thanks for doing that. So going back to Senator Dhingra, so do you work with the medical society in your state? If so, how do you do that?
Yes, absolutely. You know, bills only get passed when you have stakeholder input. And I think one of the best ways I find to be a legislator is you have to listen to the experts. You have to listen to the people who actually do the work, because the people who do the work are the ones who know what the problems are and are the ones who can come up with solutions that make sense. So I will say in 3 years, I have had the honor of passing 35 bills. And all bipartisan. I think I had one gun bill that wasn't, but other than that, all my bills are bipartisan, and that's because I believe in having a very large stakeholder process. So we are a part-time legislature, which means that we are in session from January through March or through April, depending on the year. And then we have the interim. So in the interim, I will make sure I reach out to stakeholders. When we have bills that come up, I ensure we have a meeting where everyone can provide that input, refine the bill, keep working on it. So when it comes time to introduce that bill in December or January, it is not a surprise to anyone. So I've worked with our King County Medical Association. In fact, I had a meeting with them just a couple of weeks, and they were talking about an issue which I hadn't really thought about. We apparently have a statewide immunization database, and they were talking about how that actually needs a lot more funding. Because of the technology issues and connectivity to pharmaceuticals, pharmacists, as well as the medical community, especially with COVID and potential new vaccines coming out. They were really concerned about making sure that we can track who's getting what vaccine and how one can be more effective than the other, and really have a database for that. So people now know that I like ideas coming from the community. So if I don't reach out to the medical community at all levels, they're absolutely reaching out to me and making sure that I hear them. So to me, it always is, if you can articulate what the problem is and why it needs to be fixed and have a solution, I'm very happy to champion that, because I do believe we don't need to be in search of problems. We need to make sure we are looking for solutions to the problems that already exist. So yes, all levels of the different medical boards. I will say the other interesting thing that's been happening, we also have doctors who have been certified or were educated outside of the United States. And so they have formed a very strong coalition of international doctors, and not just from India, but from all over the world. And they have really started reaching out to me and other members of the healthcare community committee, and really talking about, how can they make sure that their expertise and their background can be used and valued in the state of Washington. So that's another group that a lot of people don't think about, but they're out there and they really want to go back to practicing medicine. So we've actually in the last couple of years done a lot with them to see how we can help them get into residency programs or remove barriers for them to accessing care in the United States.
Thank you, Senator Dhingra. That was a good explanation. I do have, again, a follow-up question before I move on to Dr. Kumar. I know you mentioned a lot about surprise billing legislation. I have a question here from Dr. Gopalka. As surprise billing legislation is so important for patient financial protection, how are we planning to protect patients' care against network restrictions by insurance companies and ensure appropriate payments to providers. I mean, these are all hardworking providers and they want to make sure they get paid so they can pay their bills as well.
So if someone has a good idea or a solution to that, I would love to hear it. You know, it is very challenging to have a solution for that. So while we took that first step towards ending surprise billing, this is again something that we're going to continue to work on. But unfortunately, we're not aware of any good solutions around that. Always open to ideas.
Thank you. Thank you for being candid. I think it just makes every process that you mentioned transparent. So moving on to Dr. Kumar. Dr. Kumar, you can also comment on ACA alternatives that are happening, but I also think as a surgeon, especially as a vascular surgeon and a fellow in the American College of Surgeons, I understand that you work with the medical society, so I won't pose that question, but please do comment about any ACA alternatives that you have in mind.
Well, thank you. Certainly, yes, I've enjoyed working with my surgical and medical colleagues, the American College of Surgeons. The local chapter is very active. I always attend their meetings. And the TMA, which is the Tennessee Medical Association, was very helpful in my initial election. And since that, we have maintained good communication. We have Doctors Caucus. There are about 6 total physicians in the legislature. We meet on a regular basis to, again, concentrate on healthcare problems. And most of us tend to favor doing things to make healthcare available to all of our citizens. Regarding the Affordable Care Act, again, the emphasis in Tennessee overall has been of disillusionment. I myself wrote an article about the Affordable Care Act in 2016 when I was a freshman, during my freshman term in the national, our state paper called the National Tennessean. And at that time, there were major problems with the Affordable Care Act that we recognized. Those included the individual mandate, where the fines were
I think we might have lost Dr. Kumar. So I'll wait until he comes back. That was a wonderful discussion that we were having.
Lower than and so on. Are we on?
Dr. Kumar, I think we missed the last 30 seconds of what you were saying. Could you please repeat that, sir?
Okay. Can you hear me now?
Yes, we can. Thank you.
Okay. About the Affordable Care Act, generally the feeling was negative within the legislature. In 2016, during my freshman term, I wrote an article in the Nashville Tennessean, our state paper, explaining the difficulties with the Affordable Care Act. And they included, at that time, certainly the individual mandate that required people to carry insurance or purchase insurance. The penalty for not doing so was much less than the insurance premium. So most citizens elected to pay the small fines rather than buy insurance. That was a built-in wrong way of approaching things as far as Affordable Care Act was concerned. There was also an employer mandate that everybody who worked for 30 hours had to be covered. Well, a lot of the employers started putting people on part-time employment so that they were working for 29 hours. Now the individual mandate, of course, has been removed, which only increases the cost of the Affordable Care Act to the government. There were other problems with the Affordable Care Act, including the high deductible plans. It made no sense to sell to somebody who's making $25,000 a year a plan that carries a $5,000 deductible. And this was unfair to these people. They did not really understand and did not discover that they had a $5,000 deductible until they needed insurance and needed bills to be paid. People did not realize that. The poorest in the society, and this was the most major flaw in the Affordable Care Act, That is, the most vulnerable, the poorest in our society, were left at the mercy of the individual states to expand their Medicare plans. If the federal government, who was willing to pay for the plan for the first 3 years, why did they not at that time issue Medicaid cards to these people? Why put the monkey on the backs of the states, where it got mired in politics? Conservative states and Republican states did not cover their citizens, and of course the Democratic states did. I think there was a major flaw in the Affordable Care Act. If the federal government wanted to cover it, and I feel that was the main purpose, that was the point of Affordable Care Act, to take care of our poorer citizens and not put them in, as Senator Dhingra very well stated, and I agree with the statement, not drag them into bankruptcy because of their medical bills. Federal government should have taken care of the most vulnerable, poorest people first, and subsidies to those people up to incomes of $94,000 that should have come later, much later. And those subsidies were also distributed in an uneven way. As a physician, to us, one of the most difficult things that Affordable Care Act threw upon us is the electronic health record. A very basic thing was missing. That is, all these systems that go on sale and are purchased, or we are required to purchase, they should talk to each other. In my own hospital, my inpatient electronic health system does not communicate with my emergency room. How can you function? The idea was that this was going to make healthcare easier. Instead, it put a monitor between the patient and the doctor. And really, it has tripled physician communication, tripled the interpretation of medical records, and the cost, $25 billion. It was just a software program that could have been designed and easily replicated, instead of being sold at $44,000 or $46,000 for each physician with annual payment costs. So with those problems in the Affordable Care Act, we were very negative as far as the prospects of the Affordable Care Act. Now, the federal government and we as legislators do have a responsibility that if we repeal the Affordable Care Act, we provide an alternative. It will be morally wrong to take these people and take their health care away, not to provide them with anything. That will be wrong. And yet in politics, that may happen. I will be very disappointed, and I will work towards having an alternative available. And of course, it has to be at the federal level, that if the Affordable Care Act is repealed, we provide an alternative, and certainly a better alternative. We owe it to people. And hoping that this is an election year, maybe there can be a better discussion about it. Thank you.
Dr. Kumar, I think all the physicians in the audience are probably thinking that you're making excellent points. I think as a surgeon and physician, you sure have an advantage of understanding what the other side of the aisle looks like as well. Thank you for that. And Mrs. Cooper, moving on to you. I very well know that you're very collaborative and you work with all the associations that are related to in your state. And I'm having a lot of audience and a lot of physician audience asking very specifically about the medication. So I'll pose that question, but I also would like you to elaborate on any medical associations that you work with in your state. The specific question is, how about inhalers adding to that list along with insulin, please? Because we have COPD asthma patients, and that would avoid absenteeism from work. And also, again, there is another point about number one disease is cardiovascular disease. So how about making at least that one drug free of cost? So if you can please comment on that, and also comment on medical associations, how you work with them, that would be great.
Sure. I actually want to touch on several things. The first thing I'd like to say is I put my email in the chat window. It's padmakupa@house.mi.gov, because if you have ideas or you have suggestions on what the prescription drug task force should take up, whether it's insulin, whether it's medicine for COVID or something else, please suggest the medications that you think we should work on the pricing and putting a cap for insurance companies. I would love to hear from you. I want to actually backtrack a little bit to the ACA and what that has. We actually expanded the use of the ACA in Michigan through the Healthy Michigan and the ACA Marketplace, the Healthy Michigan Act, and over 1 million Michiganders who get insurance would lose it if we overturn the ACA. And so one of the things that I want to make sure is that 51% of Michiganders who have a pre-existing condition are able to get insurance if the ACA is overturned. And so hopefully we will get bipartisan support for this package to enact the ACA. I really am very concerned about providing an alternative if the ACA is overturned for all the people in Michigan. Second, I want to talk about surprise billing. We actually have a bipartisan bill package that is going through the House right now with Representatives Hawk from the Republican side and Representative Liberati. The two of them, he's one of my colleagues in the Democratic caucus. The bills limit patients from receiving surprise medical bills from out-of-network health providers. It passed the Health Policy Committee, and it's currently in Ways and Means. However, I do know that when it was in the Health Policy, one of the challenges was that there were a number of organizations, both supportive and opposing, and others who were neutral. So right now, the stakeholders, and I'll give you some examples of when I say stakeholders, and you all are part of professional organizations and advocate on these things. So for example, the Blue Cross Blue Shield and the Michigan Association of Health Plans are supporting it. However, Michigan State Medical Society and the Michigan College of Emergency Physicians are opposing it. In fact, that's actually how I met the president of Michigan State Medical Society when he came to my office to advocate against these bills, because he's concerned that they could be improved on. And so I know that the stakeholders are all discussing, both the people who support them as is and the people who oppose them, as well as some of the organizations who are neutral on it, the Michigan Health and Hospital Association being one of them. So getting everyone together and talking through what are the objections and how do you make it better. I actually did that with a pair of bills on electric vehicles. Again, my area of expertise being the automotive. But these are the things that we have a desire to bring people together to solve these things. And so similar to what we have in the House, there's also a package on the Senate side that is also coming up. So maybe those bills on the Senate side, I believe the Michigan State Medical Society prefers that package of bills. And so maybe we can take the good points in the House bills, the good points in the Senate bills, and bring that to be the final policy that we put into, that we enact into law. And then I kind of want to just touch on the whole issue of maternal health. It is a huge issue. And when I first met the organization known as Right to Life, they came to me and they said, you're the first Hindu in the legislature, you know, do you think life is sacred? And I said, yeah, I'm vegetarian. I think that life is so sacred that I won't eat anything that's walking or self, propelled or whatever. It's kind of a joke, but we talked about access to reproductive health care. And I said, you know, I understand that not everyone agrees when life begins and this is an issue, but can we at least agree on providing reproductive health care? Because I don't, I would like to reduce the number of abortions. And the lobbyist for Right to Life looked at me and says, I want to eliminate abortion. And I looked at her and I said, that's like saying I'm going to eliminate poverty. I don't know that that's something, I can't eliminate world hunger. What I would like to do is reduce abortion. And you do that by providing reproductive health care, especially to the ones who are most vulnerable. Women in poverty must have access to good reproductive health care. And I really am concerned about some of the bills that have come into our legislative assemblies, whether it's in Ohio, where a doctor who doesn't plant an ectopic pregnancy back into the uterus is accused of criminality, accused of murder, or when the fetal heartbeat is considered viable. I rely on people like you to help us make good decisions. So it's really amazing when I have a colleague like Dr. Kumar that I can now call, not just because I want him to be on a panel, but when a bill comes into my legislature that one of my colleagues across the aisle has introduced, and I hear from a doctor friend of mine that this isn't a good bill, I can talk to Dr. Kumar and say, okay, how do I convince my Republican colleagues that this might not be the best bill to put forward? And so I really would like you all to become activists for good healthcare, because without your voices, we as legislators can't make great policy.
So, Mrs. Cooper, that was very emotional, and it was very passionate speech of yours, especially focused on reproductive health care. That just shows how passionate you are about it. Just to kind of summarize, since we are in the last phases, in the chat window, I'm seeing a lot of questions, and I see that Ms. Dhingra and Mrs. Cooper, you are also responding to the audience and physicians, and I'm sure physicians do appreciate that very, very much. So I would like to kind of take like 30 seconds of your time to kind of tell me what is a state legislator life look like on a day. I mean, I know a lot of Indian Americans right now are so very well educated. They are looking forward to getting into policy world, getting into political life. So I'll start with Ms. Dhingra. So give us like 30 seconds, blurb about what is it like to be a state senator? What is it? How does your life look like?
Well, it is actually amazing work, and work that I am truly privileged and honored to have this role. I will say my election was very unusual because it was an extremely high-profile election. It was the first election after Trump's inauguration, and it was the first time in the country we had the ability to flip a seat and basically turn Washington blue. And so, it was what we call the wall of blue on the West Coast, or the blue wave that started on the West Coast. That was my election. And it was the most expensive state election in Washington history, which really tells us we need reform at the campaign level, financial reform. So I will say my experience has been very different than most of the legislators because of the amount of attention my race got. We are a part-time legislature, but I'll tell you in all honesty, this is not part-time work. This is a full-time job. However, we are compensated. You don't get into politics for the money. Let me tell you that. It's much more affluent not being a politician in this country, especially at the statewide level. When we're in session, it is nonstop, morning till night. During the interim, again, it depends on each legislature. Because I like to be community driven, I am extremely busy 7 days a week. I think yesterday was the first day I had off in 3 weeks. And I will say, because of COVID, because of the Black Lives Movement, because me being in leadership, that did create a lot more work during the interim than normally I would have. But it is amazing work. You meet people from all walks of lives. It is very satisfying work. I think it's work that comes with a lot of humility. So I truly, every day, I'm honored that I get to represent people in this capacity.
Senator Dhingra, we truly appreciate your hard work. Dr. Kumar, give us your 30-second blurb.
Sure, thank you. It has really been an honor to serve as a state representative. People have been extremely respectful. The legislature has been extremely receptive. And to me, the intellectual stimulation of working on so many issues that affect our society has been really great. I would like to say to our audience that you have great assets, great education, and something to contribute. So go ahead and enter the field, in the sense that your great asset is one, that you are financially comfortable, so you can take the time, about 3 months a year, 4 to 5 days a week, that it takes to be in the legislature. Secondly, you have another great asset to easily get elected, and that is your name recognition. You have name recognition, patients love you, so you're well thought of. And it's not only your patients, it's their families who know you, it's their neighbors who know you, it's their church members who know you. So you have a built-in base, capitalize on it and enter the field, and you will serve your community. And it will be very, very satisfying, extremely. So I encourage fellow physicians to realize the assets that they have by way of name recognition, education, and other qualities, bring them to the legislature. Yes, it is joyful work, it's fun work. Yes, it is politics. It gets unfair at times, but isn't life like that? But I would encourage physicians once again to enter politics. Thank you.
Dr. Kumar, don't be surprised if one of the physicians, especially Dr. Reddy, is motivated to get into politics now. Okay, moving on to Mrs. Cooper. Tell us how your life is going on.
So we are a full-time legislature in the state of Michigan. Because I flipped a district and I knew that I needed to put my 100% into running for office in 2018, in April, I quit my job so that I could raise the money and knock the doors and contact constituents. After I won and became a legislator, I still continued to knock on doors in my community. I represent about 100,000 people. The cities of Troy and Clawson in southeastern Michigan. 100% agree that representation matters. We have a lot of people who work in the automotive industry, but we also have a lot of immigrants in my district. Troy, in fact, the city that I live in, has the highest population of people who are born in another country. And it's fascinating when I knock doors, I would meet somebody from Romania or Iraq or a Macedonian. And all of them said to me, wow, you represent our story, right? We want our kids to have a bright future. We want this country to be welcoming of people like us who bring an immigrant work ethic and who want all our children, regardless of zip code, to get a good education and to have a successful future. And so I'm really honored to be that voice for all of them, for all of us in Lansing. So I want to leave you with one story. So one of my favorite things to do is elementary school children come to the Capitol. And so when they come, I usually run from my office in the House office building over to the Capitol and make sure that I take them into the chamber, because you can't go into the chambers without a state representative. One teacher told me, you're the first one in my 20 years of teaching that's ever taken me into the House chambers. So this one particular group of children, the little girl reminded me of myself as a child, two braids, heavily oiled hair like my mom used to send me with a buttu on my head. And she kept on moving here, moving there, touching this. Teacher kept on telling her, Nivi, don't do this, Nivi, don't do that. And at the end of it all, I answered their questions. After I took them onto the floor, we stood on these steps outside the chambers and took a group picture. The parents were really happy. The teacher was a couple of teachers that were with them. So Nivi had too many questions for me. And so the teacher was she's already a little been in front of me for quite some time. So then before they leave, Nivi comes up to me and she says, Representative Kupa, can you give me your autograph? And I see myself as just an everyday person, right? I mean, this is not rocket science. Learning what your constituents want and being able to go represent it and listening to people and asking them for better input to make better laws. So when she did that, I looked at her and I said, Nivi, is your name Nivedita? And you had to see her face, because not only did I correctly know her name, I said it correctly, right? And that makes such a difference for that child, because she has a different imagination of what leadership looks like, what leadership does. And so for all those Niveditas and Kalpanas and Viveks whose teachers are out there, whose representatives are out there, I just feel like this is such a huge opportunity for me to help bring them into the political process, make them feel that they are also part of, this country.
So Padma, very well said. And Representative Mrs. Kumar, Dr. Kumar, and Senator Dhingra. I ran a race recently, so I understand how hard it is to run a race and actually win. I respectably lost, but you guys actually won. Southeast Asians, you're out there with the highest educational credential, and you're representing our community, and we're extremely proud of you. And I learned a lot, and I'm sure our physician colleagues in the chat and in the call learned a lot as well. That being said, I thank you for your time on this happy Father's Day. And I'm going to let Dr. Reddy, Dr. Suresh Reddy, have some final comments, and we'll end the call right here.
Thank you so much. Thank you, Srilekha. Can you all hear me well?
Yes, sir.
Just to give some background about Srilekha. Srilekha, I met her first in Washington, D.C. to attend our legislative meet. And this dynamic young lady, I was immediately attracted to her charisma. And we asked her to do a session for our convention, but unfortunately, we had to make it into a digital version, and we did not have much time. We wanted to do on a bigger scale. Hopefully, this will continue every year during our summit. And she's a healthcare professional with a doctorate in physical therapy. And she's also the vice president of the healthcare executives in Washington, D.C. area. And thank you again for doing an amazing job. And Padma, Representative Padma Kumar, she was, I first met her in Houston when Modi came. And she is a very articulate, dynamic lady. And she did the emceeing, she did the master of the ceremony between the legislative discussion of various legislators in Houston in front of Modi. So she is like outstanding. Thank you again for joining, for your time. And Senator Dhingra and Dr. Kumar, thank you again for joining. Amazing talks. I have a personal question about things. I do, there is one saying I always follow, like if you don't lead, somebody else will lead you, and don't complain. And so I request everybody to take the challenge, and RP, even though it's a small organization, the elections are very contentious, very expensive. And one question I have for you is, I have passion to bring people together and team building. And I think I'm pretty good at it. And I always have this itch to go into the active politics. And my local mayor, Dr. Lal Malani, he was also a president of RP at one point. How do you raise money and how do you survive? Because it doesn't pay much. It's always your money losing job, and you have to work. It always surprises me how, because I see representatives running elections every 2 years. It's very difficult. Just I know you may have limitations to give all the information, but whatever you can give, how do you survive financially?
So I will say, and feel free to contact me privately. I'm always happy to chat about these issues and encourage people to run for office. I married well, in all honesty. You know, the problem is people who can afford to be in these positions are the ones who can afford to run. So when we get policies from our electeds that don't represent all of us, it's because we cannot, most legislators don't have people who've gone through a lot of adversity at the table. So my husband's an engineer, you know, I've been a lawyer, and we're fortunate that I could make the decision and afford to run. But this is where our community can step in, because not everyone wants to run. So the question is, how do you support your elected leaders? And, you know, money is one way. And I was very fortunate that the South Asian community in our area absolutely came out in support, held a lot of fundraisers for me. And so don't think that the only way you can support the policy that you want is by standing up to run. You can support those individuals who are actually running for office. And you have to leverage your network. When I ran, I had defense attorneys who threw me fundraising events. I had prosecutors. I had the domestic violence community. I had the mental health community. I had the PTSD parents. You know, for parents, let me tell you that network is huge. And we have the South Asian. And as an immigrant group, we are one of the richest, most educated immigrant group in America. And as I said in the beginning, we are represented in the engineering sector, we're represented in the legal sector, in the medical sector, but not so much in the political realm. So we have that leverage, we have the education, we have the money, we need to stand up and support each other. And that's how we make sure we have the representation that we need. So don't forget, we have large networks. And when you decide to run for office, you got to leverage those large networks.
So I want to add to that. As I said, we were financially situated that I was able to quit my job and not have an income for almost 9 months. It was a sacrifice, though, for us because my husband and I are just, everyday engineers. But over 20 years, I had built a lot of social capital. My race was one of the most expensive races in the history of Michigan because I am the first Democrat to hold a very Republican district. While I was not headline because it got lost in the blue wave or the pink wave in Michigan, I definitely tapped into a lot of the networks that I had. And literally I started with my brother in Jacksonville, Florida, my first call. And I said, the most you can give me is $1,000. And he said, sign me up. Because people believed in me. And I think that was the fortune, the luck that I had. The other thing is I want to give credit to a lot of these organizations that support the activist groups, that support people who want to run based on an issue. So let me talk about League of Conservation Voters. It's a national organization that speaks to environmental conservation, particularly here in Michigan, where we have a lot of issues around what's going on with our Great Lakes and with our water supply. One of the things I found out speaking with Dr. Bobby Mukamala, the president of Michigan State Medical Society, everyone's heard of what happened in Flint. We don't want to see Flint happen anywhere. What happened in Flint happen anywhere else in the country. And so just finding allies like that. League of Conservation Voters did local fundraisers. They knocked doors for me. They did mailers for me. Similarly, there's an actual wonderful organization because women are usually the ones who are overlooked. I will also say that state level legislators are often overlooked because our community tends to look at the national level politics and forgets that the state level and even local level elections matter. We had in Troy one year, a woman got elected who believed, and we're in Pride Month, who believed that electric shock therapy was necessary to change LGBT people. And that's just not okay in my book, right? And so making sure that your mayor, your city council, your school board, they are people who represent your values. Making sure that, and I think that was one of the reasons that people did vote for me in a district like this was because I had not been involved in partisan politics. And I was very transparent about what are the things that I represent and what are the things that I value. They are things that the community values and that I listen to people. But one of the organizations that connected Senator Tingra and me is an organization known as Emily's List. I don't know if you've ever heard of it, but Emily is an acronym. It's not a woman. But Emily's List stands for Early Money is Like Yeast. Because any women out there, you will understand, we are not as aggressive, especially culturally. I talked to Senator Stephanie Chang, who's a state senator here. As Asian American women, my mom always told me, you can change your reactions. You can't change other people's actions. You can only change your reactions. And so, the acquiescence or the acceptance, we need to learn how to be a little bit more not accepting of injustice, or when we see something wrong, we need to be able to say something. And so Emily's List provided that extra money because early money is like yeast. That's the acronym, Emily, because it helps the dough rise. So once they invested in me, then other people also saw that I was a viable candidate, that I would win this election. And so that really helped. So early money is always valuable, especially this year. It's a digital campaign for me because there's not a whole lot of door knocking that we're going to be able to do. And so those are really important things, is being able to tap into your networks, get the money. And I will say there's more bang for your buck in a state race because they're policies that affect your everyday. Where is your water coming from? How are your roads? How is your water infrastructure? Do you have mass transit in your state? Do you need mass transit in your region? These local elections are so important. And that's how I think grassroots will effectively change the partisan rancor that I see in DC.
My perspective, can you hear me?
Yes, sir.
Okay. My perspective on getting to win an election is really to develop a record of service and activism. By doing that, you will have name recognition. And by having been active, you will also know a lot of people. One, your money needs will be less because people already know you and you have contributed to the society already. Secondly, because of the large network, you will be able to raise more money also. In my situation, I actually donate my legislative salary to local causes. It's amazing. $100 or $200 to a softball team in a high school goes a long way. You get season tickets. But again, to me, I personally did not do any fundraising. Fortunately, my daughter did for me, but people were very generous and they already knew the system, the information I would need when I report their contribution and so on. So people are politically savvy in the educated circles and will contribute to, once again, if you have a record of service and activism, you are well connected with the community, so people want to support you, and your money needs would actually be less too. This year, I plan to spend very little, and I usually get 75 to 80% of the vote in my community with little effort and small financial needs. Thank you.
Dr. Kumar is surely inspired, so we'll see him on 2022 ticket or 2021 ticket now.
Thank you so much again. Thank you for answering question. I just have one request for all the audience. Whenever we do a fundraising or ask for funds, the members say, what are they doing for us? The way I look at it is we reap the fruits of trees planted 20, 30 years ago. And you collect all the fruits, but you don't leave any seeds for the future generations. So investing in these politicians is like sowing seeds for the future. And you have to do it. You can't be just selfish and just collect all your fruits. Your responsibility is to take care of the generations that are coming up. And also state politics. That's part of the reason we started this. We'll be making it bigger and bigger, or equally important or even more important than national politics. Without states, there is no national. So thank you again, and thank you, wonderful team. Thank you, Sri Lekha, and thank you, Padma, and all the wonderful team, and a big thank you from API side.
Thank you, Dr. Reddy. Take care of you all. Happy Father's Day to everyone.
Thanks.
Thank you.
Thank you, everyone. Happy Father's Day. Thanks for sparing your time on Father's Day. And
thank you, Dr. Reddy.
Thank you. You really inspired us. Thank you.
Thank you, everyone. I was in the hospital, sorry, hearing part of your conversations, but extremely useful information. And by the way, I'm Anupama. I'm incoming president for API in 2021. And so very inspired.
Yeah.
And we look forward to meet you in person sometime in near future.
Sounds good. Thank you to Vijaya as well. She's been moderating the session, making the flyers. So we appreciate the background work that gets done to put a panel such as this. Have a wonderful day.
Have a good day.
You too, sir.
Thank you.